Guys, it's time for your doctor's appointment on television. It's time for We the Doctors. My name is Dr. Jules, and you know how we do it. I do it with my colleagues. We have Dr. Valeria.
Hello, you're welcome, guys.
Dr. Yvonne.
Hi, you're welcome.
And Dr. Okey.
Welcome to the show.
You know, most times we've been talking about doing your yearly medical checkup. We talk about it all the time, and we've been talking about health generally. But one thing that people don't understand is when you're doing your health checkup, you have to check yourself in totality. And one organ that people usually miss out is Oju, the eyes. Did I get it
What
right?
does Oju Kokoro mean, sir?
Yay!
I think it's iron.
What does Oju Kokoro mean? We miss out your big eye.
No. Oju Kokoro doesn't mean big eye anyways.
It means what?
Yeah, Oju Kokoro has to do with someone that's greedy. You know,
okay, yeah, but it's still big eye, literally.
And you go for your health check,
it just means that you have eye for other people's property.
Anyway,
okay.
I just had to prove to them that I knew other languages. So we're talking about the eye today. Have you had your eyes checked? Yes, you. I'm asking you that question because most people, they seem to forget that they have to have an eye check. You don't have to have problems with your eyes before you have to check if you have a good visual acuity. And there are lots of things that the doctor can diagnose through the eyes. You know how we check ourselves for, the doctor can check you for fever and all sorts of things, and then we make a diagnosis. Sometimes even the eyes can help us diagnose certain things. So you want to go have your eyes checked. One of the things that we can detect from the eyes sometimes is hypertension. Hypertension can go as far, you know, it's one of the silent killers, and it's very, very prevalent in our environment. The hypertension itself can affect the eye in such a way that it can translate as something that we call hypertensive retinopathy. It's a big language, but definitely they can pick it up. So sometimes we've talked about the hypertension is a silent killer, and then you go there and then they see that you are already having problems. Yeah. Usually, if when you have the hypertension ignored for a long period of time, it then affects the eye and other organs as well. So it's very important because, like we keep saying, the eyes are the window to
the whole body.
The whole body.
In other places, we say the window to the soul, but it's actually the window to the body.
Hypertension, also high cholesterol too, can be fixed from the eyes. Yes.
Good.
True, yeah.
The
Absolutely.
rings
around the
exactly,
eye. Yes.
Around the eyes.
That's very true.
It
can be glaring that, you know, your cholesterol level is high.
High when you're high, from your eyes. And also diabetes.
Xerostomia.
Thank you. And also diabetes as well, mellitus, so to say.
In fact.
Yeah, but that's...
Things like cataracts and
yes.
even the one that leads to eventual blindness that people don't pick on time. That's
let me give
retinopathy.
a mischievous one. You know the way somebody comes to you and says, well, I'm 40 years. And then there's this thing we call senile arcus on the eye. And it doesn't begin to appear till you're 60, 65.
Yeah.
So you come and tell me you're 40 years. And I'm just looking at you as you're talking and I'm smiling. Because I know you are closing to 70.
From the eye. You can tell.
I've not looked at any other
But one thing I really want us to emphasize is the fact that, you know, a lot of times, a lot of people that went to see the eye, the ophthalmologist of the optometrist, optician as they were, would have gone to complain about their eyes and say, look, I can't see very well, I'm having issues with my sight and all of that. It's at that point of checking the eyes. One thing they always do at the clinics is that they also have a BP check and they have a sugar check. At that point, they realize that those people are actually either hypertensive or diabetic. So it means that some people all their life would not even know that they have high sugar level or they are hypertensive until they go on visit and realize that they're having issues with their eyes. That's when the complications as a result of this illness
are already manifesting.
All right.
In addition, let me even take it. The one we find ourselves at home. A child comes back from school and then an auntie visits, and the next thing you hear, Emeka's eye is yellow now. Simple. That's a quick catch. When we talk about liver diseases, talk about yellowness of eyes, hepatitis, the liver has already been damaged.
True.
But because you picked it, wow, Emeka's eye is yellow. What it means, it's time for Emeka to get to the hospital.
Even a red eye.
Yes.
In the case of conjunctivitis or even trauma.
Or somebody
so that's how you know that somebody slapped you on your eye.
You don't want to tell the truth. What happened? Nothing.
You just say what happened to your eye.
Nothing. Why is your eye red? It's a man that slapped me.
Also, anemia can be picked.
Yeah, exactly.
the
Very
eyes.
well.
That's
True. Yeah.
Very
And that's
well.
actually why you go to the hospital. Doctor wants to
Yeah.
look at your
Check
Look at
and then
your
see if
eyes,
you're
they
pale or
see.
not. Yes.
Yeah,
And
so it's very important. And it's good that people are listening now and they can see that the long-term effect of, they are watching, the long-term effect of hypertension and diabetes can be picked. And it's not only the eyes, other organs like the kidneys, you know, the liver,
Yeah.
they're already affected. So for one part of the body to be affected already, you need to get the
Exactly.
others checked.
Absolutely.
So it's very important to have your eye examined. So if you've not had that comprehensive eye check, you want to stay tuned because our ever-day articulate Dr. Okey volunteered.
The ever guinea pig.
Volunteered to go for a comprehensive eye check with the camera crew earlier on in the week, and he had a fantastic
I told you
time.
you were wearing a pair of glasses earlier.
Yes, so
you're
it
just
was
up
a
there that you're not
result.
used to wearing
Don't
glasses.
worry, when we come back, you want to see Dr. Okey in a pair of glasses. You want to stay tuned, but let's see how he started his journey. Join us as we go on this journey with Dr. Okey. Do you use adult toothpaste for your children? Doctor says the fluoride in the adult toothpaste is much higher. It can cause damage to the brain, the kidneys, and the bone of the child. You want to get the toothpaste that is customized for children to avoid this. And that's what doctor says.
Hi, I am Dr. Okey. Earlier today, I referred one of my patients to the ophthalmologist, that is to say, an eye specialist. And then I realized it's been a long time I checked out even my own eye. So I decided, let me get to the eye doctors. Let me have my eyes checked out. So let's go in. Hello.
Good afternoon.
Yeah, I called earlier that I was coming today to have a look at my eye.
Okay.
So how do we do it?
Okay, you're welcome to the eye doctors.
Yeah.
Are you a private patient or are you under any HM?
Yes, I'm a private patient.
Okay, so we'll go on with your registration. I'll give you a form to fill and I'll give you our tariff to look at.
All right, that will be fine. I even forgot I was with you guys. See, sometimes when you come to the hospital, I'm a doctor, but I have to keep the queue the way it is. I have to wait for them to see the patient, and then once it's my time on my appointment, I go in and I get to see the doctor. So just hold on with me.
Excuse me, sir. Doctor.
That will be fine. So let's go inside. I just decided today that I referred the patient to the ophthalmologist, and I felt it's been a long time I saw my own eyes checked out, so let's hope I'm fine.
So how long?
Wow. I'm on TV, but I'm going to say it. It's
Okay.
been, let's say, 4 years, 5 years, 2009.
Wow.
That's a long time, sir.
Okay. So is today just a routine test? Or?
Yes, today's just a routine, sir.
Okay. So we just need to take some details from you.
All right, sir.
Any complaints at the moment?
Right now, no. Okay, I have one. Sometimes when I look at a computer for a long while, I feel like my eyes are a bit tired.
Okay.
So I just look away and continue what I'm doing.
Okay. When you say long time, how many minutes?
Maybe 2 hours, 3 hours. Most of my life, I'm either on a phone, on a computer, sir.
Okay. And do you have good distance vision when you look in the distance?
Yes.
Okay. What of when you read? Any problems?
No, I don't have problems when I read.
And what's your general health like?
It's fine. I eat well. Obviously, I'm trying to get down on my weight still because my BMI says I'm overweight.
Well,
sadly.
We're all overweight.
But generally, I'm fine. Sir.
Okay. And you're not on any medication on a regular basis?
No, I'm not on any medication.
And any eye problems in the past?
No, sir.
Okay.
No.
And very important, any eye problem in the family?
My parents both use glasses
Okay.
to read.
Okay.
My dad only when he's reading.
Okay.
My mom has short-sightedness.
Okay.
I just guess that was the thing with age, though. But I'm not sure.
Okay, we'll discuss all that afterwards. But is there any glaucoma in your family?
No, there is not.
Okay. Any blindness in your family?
No, sir.
Okay.
No.
Because those are very important questions you have to clarify. Okay. So after taking all these details, what we'll do, we'll get you to read some letters just to ensure you can see in the distance and see at near. Okay. We'll, if there are any issues there, we'll do what we call a refraction.
Okay.
Which means essentially you read some letters and we'll see if we can improve your vision with lenses.
Yes, sir.
Okay. The other checks which we will do, which is the pressure check, to try and see if there's any sign of raised pressure, because that's one of the risk factors of glaucoma. And then we'll look at all the structures of the eye with the slit lamp. And then we'll also have to dilate your pupil. Now, if all these routine tests show any other thing, then we'll do some further tests, which could include maybe visual field analysis or things like that. We'll just start with the routine refraction tests. Okay. But let's have a quick look at your eye before we do the refraction. Okay. It's like a microscope. Okay.
Okay.
And all it does, it magnifies your eye, so I can see a bigger eye and see the structures. And it also puts a bit more light on where I want to have a look at. Okay. So pop your chin up there for me.
I should have my eyes open.
Open eyes open. Look straight towards me. Okay. Right. So it's going to be a bit of a bright light, but just try and ignore the light and look straight ahead. Okay, good. Okay. So I've looked at the front part of the eye. Of your right eye, that's normal, and this is your left eye I'm looking at now. And the front part of the left eye is normal as well. Okay, just look down a little bit for me. Good. On the other side, look down. Okay, all good. Right, sit back. So this is what we call the anterior segment examination.
Yes.
That's the front part of the eye. Okay. We have some certain lenses we use to look at the back part of the eye, but I'll do that after you've had the other test done. Okay. So let's go to the next room. You have what we call the auto refraction, the refraction done by computer.
Okay.
You have a screening pressure check, and then we'll pass you on to the optometrist, who will see if you can. If there's any visual challenge, if they can sort of like see if you can see better with lenses. Okay.
Dr. K, you're welcome. Please sit down. Let's run some tests on you.
Wow, thanks. I hope everything comes out normal. Let's try it and see.
Your right eye pressure is 16, your left is 17.
That's fine. Less than 18 is right, normal.
Yeah, that's fine. Depending on other parameters, actually.
But this is fine.
This is fine.
Yes. So, where do I go to next? My report
You're
is
welcome. You're welcome. So I'll take your file. For your test.
But anyway, it's normal. If you want to check your eye and be sure you don't have a problem with your eye, this is what you have to do. They get to tell us eventually how often one is expected to do this every year. But it's important to find out the status of your eye, the health status of your eye. Yeah, so let's do this.
Okay. As I told you earlier, we did an objective refraction over there. So we do the subjective refraction. That's to know if really you need glasses.
So this would say.
You will say if you need glasses. This is subjective.
This will show what my eye is saying.
Okay, you want to put it that way. This will show what your eye is saying.
Okay.
Okay?
Yeah.
All right. Let's go ahead and do this. So we'll do it monocularly.
So what are we doing now? Okay, I'm going to read the chart. There's a chart.
Yeah, that's the Snelling chart, but it's a digital Snelling chart.
Okay.
So you know how for you to know Snelling chart, so we start with 660 till you have the 66, that's perfect vision that everybody talks about, 2020.
Is it possible to cheat?
Let's see if you can cheat, sir.
All right, first I won't cheat, then if there's a problem, I'll try to beat the system. Let's try it.
All right, so let's see how you will do. All right, so go ahead, call out the letters for me.
That's R.
Okay.
SH.
Okay.
KZD. NSZR. DHSKN.
Okay.
KRSNDZ.
Okay.
ZHSNRKD.
Okay, now this is 6's vision.
Okay, fantastic.
Okay, now I want to push you further.
SKZRHDN.
And I push you a little more further.
NRKDZHO.
Wow, your sight is actually good.
On one eye.
Yeah, when I open the other one, it will be sharper. Okay. Now let's make sure. I don't know if you crammed my legs.
No, I didn't.
So let's make sure you didn't cramp anything, okay? So I changed the letters. That's why I love digital.
Okay, so
you know, with the other one, it's there. Someone can cram it if they can. But now I've changed the letters. Just look there.
Okay, so that's D.
Don't read yet.
Okay.
Just, how does that look when I add this?
I think I can still read it, but it's not as clear as, yes.
And how about now?
What do I say? I can still read it, but it's not as sharp as...
You prefer it like
I prefer this.
So we checked one eye, now we check the other one. Can you see that?
Yes.
Go ahead.
DHSKNRZ.
And?
SRDNHZK.
Okay.
Wow. KNRZDMO.
Okay. Is there any difference when I add this?
Wow, they all look squashed now.
Okay. So, like I said, the computer gave us an objective reading, but you tell the doctor finally that, hey, my eyes, I can actually see better without glasses.
Yes.
So I'll give you a clean bill, 6's vision.
Yes.
Okay. And let's check your near vision.
Okay. I should read this.
The smallest you can read.
I can read printing of this size is only used for N4, yes. It's only used for special applications, including technical data on instrumentation.
Very soon you will come back for this. How old are you now, sir?
31. I was 31 yesterday.
You're still far from presbyopia.
Okay.
All right. So that's it. So this is used to check the externals. Okay. We can actually use Okay. Thank you very much.
Now this is a retinoscope, and this is an ophthalmoscope. Now sometimes when you come for an eye check, your doctor may want to use this to look into the back of your eyes. When he does it, it gets really very close to you. It's like face-on-face contact, just to get to see the back of your eyes. I don't think you should be uncomfortable when he does that. You feel slightly uncomfortable, but please, hopefully you should not mind him doing that. It's just a short discomfort. Just look at the back of your eyes to be sure your eyes are fine and that you can anyway see properly with the back of your eyes. So an ophthalmoscope and a retinoscope. Just remember that this is big and this is kind of
small
flat.
head.
Yeah. Earlier I told you that to examine your eye with an ophthalmoscope may be uncomfortable. Let me tell you how uncomfortable it is. It starts by first of all turning off the lights. She has asked me to do that, so I'll turn off the lights. And she now really gets very close.
Do I get
Yeah.
That's okay.
I'm almost sure you didn't see anything. That was because the lights had to be out, and then she had to come very close to my face to look at it. Don't complain when your doctor does that to you. So she wants to look at the second eye. And that's it. I will not tell you what the results are now, so we'll get to tell you that later. Okay, I've done the prelim tests for glaucoma and my eyes are fine. But for completeness sake, there's a test called the central visual field check. It's like you want to look at the visual field to be sure I can see from side to side. It's like the completion of the test for high eye pressure. Let me go in and get it done so I can come out and tell you I have a clean bill of eye health. Let's go in. Now, believe me, I'm used to teaching patients what to do. But you know these reports, it's a tough one. So I'm going to go up and ask the doctor to explain it to me. They come with me. No, but I don't know why you guys think this is not plain. Now the glasses are fine for me.
However,
astigmatic, what was that again?
They said it's an astigmatic myopathy.
you know what you're suffering from?
I'm not suffering from anything. I'm not suffering from anything.
Well, it's a good thing that you went and you found out that you needed something.
No, forget this. Really forget this. I'm not using it.
Why not?
I don't want to use it.
You're being a bad example to our patients.
Okay, okay. But let's get this thing clear. First of all, it was an ophthalmologist that I saw.
Right.
The man. Clearly, let me explain, because you see, you just go into the hospital, you get to see different people, and I keep calling everyone, doctor, doctor, doctor. The first guy was an ophthalmologist. That's basically a doctor who went to medical school, finished medical school, then went back for another 5 to 7 years of specialization. In or on the eye.
Yeah.
Exactly.
Basically. So every single thing that can be done on the eye, this guy knows about it.
So you can do surgery. He's a medical doctor. That's the background. Of an ophthalmologist. But some people go and see the optometrists, for instance.
Yes.
So let's tell them what the difference is.
The difference here is more like the optometrist's job. We all know now. He studied vision. So that is to say, like in that video, it was an optometrist that told me I had this, that I needed to
wear glasses.
Yeah, but the optometrists tend to make diagnoses as well. They also, you know, see patients and stuff like that. And I think we have them more in our environments than even the ophthalmologists.
There are a lot
anyway,
of them.
But definitely, they are not the ones to do the surgery.
No,
like if they have advanced cases like cataract or...
they don't do the surgery.
Yes.
They could be there in the theater because sometimes they have to recheck.
Absolutely.
When the ophthalmologist is pinned on that microscopic lens, he may not get the time. Yes, the eye has been studied, the refraction has been done, but the optometrist can be there in the theater to help out in what's happening. But basically, he's not the lead. He's not the surgeon.
Yeah.
Exactly.
Okay, so let us talk about the optician.
That's the guy that brought this.
Because it's good they know, because people just generalize. And anything having to do with eyes, I've not seen my optician. I've not seen my optician.
Exactly.
Yeah, the word is overflowed.
Yeah, but then again, it's because people don't know this thing.
So that's what I'm saying.
The optician is the guy that makes glasses.
Finish.
Simple. It's like, I'm going to say it this way, but that's what it's like. It's like a carpenter. You already have an instruction. I want to cut 2 by 2 wood, 15 inches. That's what the optician does.
Exactly.
The prescription has been given. I want all of you that normally wear glasses, because me, I'm just starting, so you should tell me better. I want plus 2.5, I want plus 0 point this. His is to pick the glasses with. If you say AR lens, he makes it, and basically that's what.
So basically what the video is telling us, that if you want to get a comprehensive eye check, you need the ophthalmologist to do your assessment. When they've ruled out every other thing.
You need an eye hospital, not just a roadside shop that makes glasses.
So if they've ruled out every other medical condition and it's like, oh, you just need corrective lenses, if you now want to go and get another pair, you are advised to go every year or 6 months thereafter, you can see the optometrist or the optician to get your lenses. But the doctor, your primary physician, if you need anything extra, will be able to refer you back to your ophthalmologist, yes?
But I used to make a joke. I used to say, if you want to change your frames, please go to the optician. That is to say,
the frame.
Because the frame is going to get a larger size of glasses. Imagine I'm using insect eye, and then I want to change to this pencil thing. That's the truth.
My world.
About it
Anyway, very interesting so far. Let's share a little story with someone that wants to tell us how he has benefited from regular eye checks over time. Stay tuned, please. You don't want to go anywhere because we, the doctors, will be right back.
All right, that has been our show for today, Comprehensive Eye Checkup. I'm sure most of you have already called before the program ended. You've already called your doctor that please book me to see an eye doctor. And if you are registered on a HMO, I'm sure you're covered to even see them for free. And you don't even know. You've not even exercised your rights.
But you know there is no free meal, Dr. Jules.
What do you mean?
Free meal. They've already paid for the HMO
Well, yes,
somehow.
the company has already paid for you, and you have the card just sitting down somewhere. Take advantage of it. Even if you are registered on a family plan, tell your family, go and have your eyes checked. And of course, there's a part 2 to this episode. I'm sure you're wondering why Dr. Okey is like reluctant. He's removing the glasses.
I was about to mention.
Putting it back on.
I guess it's because he's not used to it.
Dr. Walera and I, we are very, very, obedient.
I don't plan to use
And maybe next time I will wear my own glasses.
I'm not going to use it.
And then we'll talk about that when we have the part 2 episode of this. You don't want to miss it. So that has been our show for today. Thank you so much for watching.
And they should send their comments, really.
Send your comments, please. I must not forget, at We The Doctors. You can also watch the episodes on YouTube. Just search for We The Doctors. And, of course, you see the past episodes there. So we are saying at this juncture, bye-bye.
Bye-bye.
Stay healthy.
And stay healthy.